never have sex again.
When did your pain start?
I'm telling Frank.
We were in the middle of making love. And
I'm in a lot of pain, doctor, a lot.
A headache?
This morning we were having sex.
Searing pain in my head, like a bolt of lightning.
I had this sharp pain in my head, like a lightning bolt.
When I first heard this, I thought it was Groundhog Day, but as an ER doctor, I've seen far too much already. Patients like this are obviously here to scam drugs, but I didn't have any proof. So all I could do was order blood work and a head CT first. Then I told the nurse about my suspicion, and she agreed with me. She asked why I didn't confront them directly. That's a stupid question. If I had evidence, I would have called the police already. Both of their CT scans came back normal, so we could rule out a stroke for now. I went to inform the first patient, but she said she felt even worse than before. Her husband asked me to give her more medication, which was obviously not going to happen.
Can I get a couple of extra pillows? I think it might help if I can prop my head up.
Then I went to see the other patient and told her the same good news.
My stomach hurts too. Is there any way I can get some stronger painkillers?
Sorry, not until your labs come back.
That only deepened my suspicion. I asked the nurse to come with me to do an ultrasound of her abdomen, and outside the room I asked whether anyone in the other rooms was complaining of abdominal pain. Don't blame me for being overly cautious. Suspecting a patient is never easy. If I were wrong, my medical career would be over. But thankfully, Nurse Laura has a detective boyfriend. He was investigating a couple who were going from hospital to hospital scamming drugs, and the situation sounded very similar to mine. So I asked Laura to call him and have him come help confirm it. Then I suddenly remembered I still needed to do the ultrasound, so I hurried back in, but I didn't find anything abnormal at all.
No swelling, no bleeding. Everything seems normal.
Look, does this mean you're not going to prescribe anything? Because she's obviously hurting.
While I was explaining things to her husband, she suddenly vomited all over the nurse. If she was faking it, then her acting was way too convincing.
I'm gonna go change.
It was pretty disgusting, so I used checking on another patient as an excuse to leave. I asked the patient whether she had mentioned any abdominal pain, but she shook her head. The nurse had already changed her clothes, and she said someone was looking for me outside. I guess the detective had arrived.